Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. May is Mental Health Month, and joining us is Dr. Michael Jablonski to discuss the results of a brand new national poll that found that 83% of those diagnosed with depression say that life would be easier if others could understand what they're going through. Welcome to Health Professional Radio, Dr. Jablonski. Thank you for taking the time this morning.
Neil, thanks for having me.
What exactly is your area of expertise? Give us a look into your background, if you would.
Sure. I was classically trained as a neuroscientist and have done basic laboratory bench work in fields of neurodegeneration and sleep medicine. But most recently, I've been working in the space of psychiatric pharmacogenomics, and we've been evaluating the potential for an individual's genetics to guide medication selection for those suffering with depression, anxiety, ADHD, and other mental illness.
Now, I understand that you're there at Myriad Genetics.
That's right, yes. I'm the Vice President of Medical Affairs for Myriad Genetics, and specifically the Neuroscience Mental Health Business Unit. Again, that focuses on depression, anxiety, and other neuropsychiatric illness.
Now, Myriad Genetics recently conducted a GeneSight test, the results of which we're going to talk about, the GeneSight Mental Health Monitor national poll. Talk about this poll and the reason for conducting it in the first place.
Sure. The GeneSight Mental Health Monitor is a tool for us to understand the realities and situations of those individuals that suffer from mental illness. And we recently conducted a survey to evaluate depression. And it's so significant because more than 17 million adults suffer from depression over the course of any year. And as you mentioned, Neil, one of the significant findings from this survey was that 83% of those questioned say life would be easier if others understood what they were going through.
People get depressed. People get blue, I guess. That's kind of an old term. Are we talking depression that is debilitating, or are we talking about I'm having a bad day, things aren't going my way, and I'm going to deal with it mentally?
Yeah, it's a really important question because I think it's common for many of us to feel blue and to feel down, and those are normal feelings that anyone can have. But depression is really different from that. It is characterized by debilitating side effects and symptoms, that really contribute to a decreased quality of life. And what we've learned is, it's not that people with depression are lazy or dramatic, but, their symptoms really are debilitating, as you said. And with the proper treatment, depression can be alleviated. There are tools to be used. Ours in particular is the GeneSight test, but it's a genetic tool to optimize medication selection. But there's many, opportunities for individuals to partner with their healthcare provider to find the right therapy for them.
I've heard that in the world of addiction, drug addiction, there are those who maybe aren't addicted who will say, just get over it, work through it, be stronger. What contributes to this lack of understanding about clinical depression, debilitating depression, and not just someone having a bad day?
I think it's such an important point because, what we found in the survey is that patients suffering from depression would often hear exactly that from their loved ones. Just get over it. Everyone gets sad sometimes. But depression really has a persistent feeling of sadness. It lasts longer than a few weeks. And symptoms can range. It's not just feeling blue. The symptoms can range from anything to anger or irritability, frustration, even where small issues really contribute to larger problems for that individual.
You mentioned some emotions, behaviors that maybe one wouldn't associate with depression, anger, agitation.
Absolutely. There are many symptoms, and you listed a few of them, related to anger or frustration, loss of interest in activities, and things like diet and sleep can also be affected. So there are many symptoms that characterize depression, and it's not just one isolated symptom to really define it.
If those of us who are not suffering from that type of depression feel that way, dismissive about this type of serious condition, doesn't it stand to reason that the person suffering from this condition wouldn't understand it either?
Yeah. Well, I think it's a very important point. And really what we're trying to do with our survey, we actually partnered with a patient group, the Depression and Bipolar Support Alliance, to raise awareness about depression. Now, that may be individuals that could be diagnosed with depression that haven't. It could be family members that have someone in their family with depression. And what we've learned from this survey is to really understand that if we can provide empathy and support for people with depression, asking them how I can help, do you want to talk about it? Those things can be really helpful. And I think it's a critical point that, if we're able to raise awareness, we're able to talk about the symptoms of depression, people can ultimately get the treatment that they need.
Embarrassment, stigma, the fear of being ridiculed, are those factors that prevent a person who is in serious trouble from seeking the help that they need for their depression?
I think there's no doubt about that. I think there is a stigma associated with mental illness. These feelings of the sentiment that you can just get over, this depression really contributes to lack of treatment sometimes where needed. And you see that across all different communities throughout the country, the stigma associated with that. And I think if we're able to open up the discussion, be welcoming to that discussion with our loved ones, our friends and family members, people will ultimately be able to get on their path to mental wellness.
Loved ones, friends, co-workers, family members. What about the understanding, or I guess empathy, with the healthcare provider? Is there a lack of understanding about mental health in the medical community as well?
It's not uncommon for patients with depression to be treated by their nurse practitioner or their primary care provider. And, I think the stigma is less in the healthcare community. Now, recognizing those symptoms and having an honest conversation with your healthcare provider is something that will definitely be beneficial, and I encourage people to do that. But the reality is, treatment can occur anywhere in the healthcare system, and highlighting those symptoms, bringing those concerns to your healthcare provider can be very beneficial to start that conversation.
Are those the only factors that GeneSight reveals in an evaluation?
Well, the GeneSight test, is a little bit different. It does analyze a patient's DNA, and it can inform doctors on medication treatment decisions. It evaluates specific gene-drug interactions. So, for example, in the genetic space, we're able to understand how the body might break down an antidepressant. Is it faster than normal? Is it slower than normal? And you can optimize dose adjustments based on that. And it really gives the provider, a roadmap to understand from a genetic standpoint how an individual may react to a certain medication.
Is there a place that we can learn more about Myriad Genetics and about the GeneSight test as well online?
Yeah, absolutely. Please, I encourage you to visit our website, www.genesight.com. It's GeneSight.com.
Great. Now, finding depression treatment remains a challenge, I'm sure, but GeneSight is leading the effort to reduce trial and error in that area, I do believe.
That's exactly right. By working to optimize medication selection with the healthcare provider, hopefully patients are able to get on that right treatment sooner. one of the realities of depression is that when we are treating depression with medications, it can take 4 to 6 weeks before we see a good response. And through a trial and error process, that path can last quite a long time. So if we're able to optimize medications earlier on with the GeneSight test and the genetic evaluation, we can get those patients on an appropriate therapeutic sooner rather than later.
Well, Michael, I appreciate you joining us here on Health Professional Radio this morning. Hopefully we can speak again, hopefully before next May.
That sounds great, Neil. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Michael Jablonski of Myriad Genetics. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.